thank you for that question. So intermediate hyperglycemia is, of course, the IDF term for prediabetes, as we know. And we are very much interested in how we can prevent the development of type 2 diabetes from prediabetes. And we have found in our studies that the best way to prevent prediabetes is actually to restore normal glucose regulation. We call this remission. So, and you may know remission from type 2 diabetes, the direct trial. It was very famous, and it was tried to get people with diabetes back to a normal glucose regulation. And basically now we are studying the same in patients with prediabetes. And in prediabetes, it seems to be easier to go back to normal glucose regulation, but the benefits are very big, very high. That is important. So the remission of type 2 diabetes is mainly mediated via an improvement in beta cell function. That has been nicely shown. And interestingly, in prediabetes remission, it is both. It is beta cell function that needs to improve, but also insulin sensitivity. And depending on how much body weight you lose, if you lose more body weight, it's more the insulin sensitivity. If you lose less body weight, it's more the beta cell function. This is how we can describe it in prediabetes remission. Yes, so in diabetes remission, it's of course a little bit different to prediabetes remission, because in diabetes we can use medication. In prediabetes, we usually do not use medication, maybe metformin, but usually we only use lifestyle interventions. Now in diabetes, the direct trial has shown that a lifestyle intervention and a very low calorie diet has a very big effect on remission. But of course, bariatric surgery also induces remission. That is clear. Now with medication, it's different, because remission per definition does not have medication. So you need to then get rid of the medication. And therefore, I think medication can maybe induce remission, but then to keep it is difficult. So it's the best way to reach it without medication, basically. In prediabetes, what we are doing, we use really lifestyle intervention. And the lifestyle intervention is effective in 30 to 40% of our patients. And when we increase the lifestyle intervention, that it gets more effective. And bariatric surgery, this is a study that we did and that will come out in diabetes care very soon. We reach 80 to 90% of remission.